award for excellence in scientific research in palliative care is being presented to Dr. Melissa Aldridge. Dr. Aldridge serves as Vice Chair for Research at the Icahn School of Medicine at Mount Sinai and is a nationally known health services researcher. She established an early track record of research abstracts, publications, and research grant support focused on patterns of hospice use, transitions in care at end of life, and the financial incentives driving care of those with serious illness. Congratulations this year to Dr. Melissa Aldridge, who has distinguished herself as an outstanding investigator, educator, and research leader in our field.
I'm honored to accept the AAHPM Award for Excellence in Scientific Research in Palliative Care. As a doctoral student, I began my career studying hospice care in the U.S. from a health services and economics perspective. I was interested in studying the impact of the growth in the number of for-profit hospices on patients and families. At the time, I knew far more about healthcare markets and the economic incentives of for-profit and nonprofit ownership than I did about hospice care itself. Although I never explicitly intended to build my career focused in hospice and end-of-life care research, the more I worked and spoke with people in this field, the more I understood the magnitude of the issues to be addressed and the vulnerability of the patient and family population. This compelled me to continue to ask more questions. I have this community, the palliative care community, to thank for my growth as a researcher in understanding hospice and palliative care from the patient and clinician perspective. What it's like for people to enroll with hospice, and what it's like for clinicians to provide end-of-life care. This perspective has been key to informing my research and having a more holistic perspective, and for that I am extremely grateful. I'd like to take this opportunity to thank my research teams and mentors. Sean Morrison in particular has been inspiring in his determination that palliative care policy and practice is grounded by scientific evidence. And my research team at Yale, in particular Betsy Bradley, whose passion for understanding patient outcomes within the larger context of our healthcare system has been instrumental in forming my health services research perspective. Finally, as someone with a doctorate in health policy from a school of public health, I can say that there are challenges for non-clinicians in developing a research career in our field, particularly in funding mechanisms and leadership positions. I want to encourage my fellow non-clinician researchers to continue to advocate for these resources and to thank the Academy for expanding opportunities and recognition of researchers from diverse disciplines in making valuable contributions to the field of hospice and palliative medicine. Thank you.